Okay, welcome, my dear friends. It's me, Evans Fosire. I would like, before we continue, to appreciate your support for liking, sharing, and subscribing. Thank you so much. I love you for free. May God bless you. So today I know most of you have slept, but I would like to share with you a few things concerning communication skills, and more so on health among the healthy workers and the patients, the clients, usually uh, those clients and patients we attend. So today I would like to share with you on the importance of communication skills and why should we communicate. It's a common topic. Be it you have gone to the university, be it you are in college, be it you are in high school, this is a common subject to all of us. But sometimes it seems it's not a common uh, topic, a common subject to everyone. So it's good at least we remind each other on this. So let's go now straight. We also want to know from the introduction part. What is communication? Somebody may ask you, what is communication? So, communication is just a transferring of information from one place, from one person, or from a group to another group, or from one person to another person. So, that is how you can define communication, just transferring information from one place to another place, from one person to another person, from one group to another group. So we also expect this communication to be effective, efficient, and we think is very, very crucial to health workers. So uh, skills which are necessary for effective communication in mentorship relationship. So number one, these skills we need to have active listening. So when we say active listening, somebody can tell you that you are really active listening. You are really listening, and this can be noted when somebody is talking to you. He or she can know this person I'm talking to is really listening to me, what I'm telling him or what I'm telling her. So one of the things maybe can tell that you are active listening, maybe nodding your head, uh, maybe responding to those questions. Maybe you are being asked, maybe looking somebody there to her eyes or to his eyes. So it shows that you are really listening to this person. But when you are focusing on something, you are repeating, what did you say? uh, I'm not hearing you. Maybe those questions, or you are concentrating on different thing, or you are looking at different place where when somebody is talking to you, it seems you are not active listening. Another skill is that somebody knows that you are really listening. Sorry, you are which is necessary for effective communication. We have verbal communication. So verbal communication, the way I'm talking to you right now, I'm doing what we call verbal communication. So another one is non-verbal communication. Non-verbal communication, it means somebody like can be nodding the head like this, or just saying no, or doing doing like this, or just doing like those doing signs. So it seems that that person is doing non-verbal communication. Then another thing is writing or written communication. So when you write something, that's a skill which is necessary for effective communication. So when I write something like now, I can write you a letter, I can write you some question to answer, then I can write you a statement. So when you read these things I'm writing, then I'm doing what we call effective communication. Those are skills which are necessary for effective communication. And then another one is questioning skills. Sorry. So questioning skills, it means like now I may ask you, are you coming tomorrow? Then you tell me, yes, I'm coming tomorrow. So I'm doing what we call I'm embracing what you call, just demonstrating what you call skills which are necessary for effective communication. So if you say yes, then now you have gotten that clearly. Then summarize. If I was doing a certain topic, or I was giving a lecture, or I was uh, uh, reading a certain report, then at the end of my communication, I just summarize whatever I was communicating. Then I'm doing what we call summarizing. So that summarize is also a skill which is necessary for effective communication in mentorship relationship. So another thing is culture awareness. So it's also among skills which is necessary for effective communication in mentorship relationship. Then another one is electronic. Electronic, it can be like a radio, it can be like a television, it can be a phone. You are communicating from one place to another. So if you are using a phone to communicate to another person, maybe if I am in Nairobi, I'm communicating to somebody who is in Mombasa through a phone, then that skill is necessary for that effective communication in mentorship relationship. So those are the things you need to know, which are necessary in in effective communication in mentorship relationship. So want also to know importance of communication. Importance of communication as an healthy worker who is attending that client, who is attending that patient is there. There are those things you need to know, and they are very very important when it comes to communication. So that's why we want to say, want to know the importance of communication. Why should we communicate? So number one, has the ability to drastically improve patient care. So it means that when I'm talking to another colleague, maybe to administer uh, a certain drug to a patient, or a clinician is telling me to administer a certain medication to a certain client or a certain patient, or dispense some drugs to a certain clients. So if I follow whatever, if I listen clearly and follow whatever I was asked to do, then we are going to increase, or we are going to improve the patient's care at this time, because I was listening carefully, I got the message carefully, then I read maybe whatever was written in that patient prescription. I read it clearly. Then when I want to dispense these drugs to this patient, then if I do the right thing which was written there or was communicated to me, then at the end of the day, I'm going to improve the patient's care. Then number two, it has important element for continuity of care. So it seems that if I've been given and I've been handed report from maybe the shift which was taking care of a patient in the ward, then here I am with my maybe another team or me alone. I'm being handed a certain report from a patient from a shift which was there. Then if I really listen to what the team handing over to me, if I listen clearly what they are telling me, and then at the end of the day, I'm going to continue with this, the care of this patient in a appropriate, in a proper way, in a professional way. So that continuity will continue uh, without being interrupted. But if I'm not listening, if maybe I'm stressed up, I come to duty, I'm not listening, maybe I'm really bitter. So if this team is going to hand over report it to me, then it seems I'm not going to listen whatever they are telling me. Then when it comes to now to the patient who is there, maybe who needs to be monitored in the ward, I'm going to miss very very important things. So at the end of the day, what happens? This patient, they're going to be left so unattended. So they'll be neglected. So at the end of the day, this patient, there's no continuity of care, and then the patient will tolerate, the patient will suffer. Then at the end of the day, we are doing nothing. So communication is very, very important. So this now, when we say it's important element for continuity of care, it helps in handing over, it helps in transfer of patient, it helps in emergency. Like now, for example, we have uh, case in the world. Like now, we can say cord prolapse, or we can say we have postpartum hemorrhage. Maybe I was there, maybe attending to this matter, and there is now PPH. Then when I am calling for emergency, please come. So when they come, I need to explain to them for a matter who is in the ward. She has just given birth right now. The mother started bleeding. Then maybe I suspect there's a uterus which has not contracted. There's no tear. The blood is okay. Clotting factors are okay. There's no tissue remaining. Maybe it's a uterus which he has not contracted. Maybe if I have not communicated well to this team who have come to help me during this emergency, then at the end of the day, uh, during this time of emergency, that communication, that continuity of care cannot go well. So at the end of the day, we may lose this patient. So it means those people who are there in the world, please, when you handing this client to other team, when you are giving a report because you want this patient to be continued being monitored, please, I'm watching you, my dear friends. Just listen carefully. Just read that statement carefully, and then it is going to be well with this patient. The care will continue well without any problem. When it comes to transfer, maybe I'm having a patient I want to transfer to another facility. Maybe when I make a call, I'm not really communicating well to the other team. Then when I transfer this patient, maybe I missed some information. I didn't pass the certain information which was very important. Maybe I'm hiding something. So when the team take over from me, then they are going to miss so many things which are important to this patient. And therefore, they are going to miss so many things. Then the continuity of that care, it will stop there because now they will start zero. Everything will start afresh. So the patient, the care will not continue as it was. So it's really important we do this communication so it's just to improve or to have continuity of care for these clients. And then another importance number three, we have to prevent serious medical errors, especially when it comes to medication, when it comes to repetitive tests, when it comes to accuracy in patient plan, when it comes to delay to care. So it's really important. So when we mean medication, for example, if I did not write well, if I did not communicate well, like for example, I can tell somebody, please, can you give oxytocin 10 international unit IM? Somebody, if you didn't hear me well, maybe I didn't communicate to you, didn't listen well, then you are going to administer your own things at the end of the day. So you are going to make errors in the medication. eh. So if I have told you give diclofenac IM, maybe 150 milligram IM, then you go ahead and give intravenous. What are you going to do to this patient? You never listened well. You never listened to me. You never asked me question. Maybe you didn't hear well. You never asked me question so that I can uh, repeat my statement. So at the end of the day, you are going to mess with medication. So you are going to have those errors. Then repetitive tests. So if you didn't listen to me, maybe I told you we have done this matter came to us. We have done urinalysis. We have done fumogram. We have done maybe another test like urinalysis. Those tests, if you didn't hear me well, maybe I didn't write them in the file. Then at the end of the day, you are going to repeat this test to this patient. Then it's going to incur more cost on the patient. Then you are going to waste the hospital resources at the end of the day. So we are going to make these errors. Please, let's avoid this. And then inaccurate patient plan. So if I'm having a patient, I've been in 12 hours shift, maybe I've been taking care of this patient well. Then when I'm handing over to another patient, another shift, maybe I never communicated well what they're supposed to do. I never write the care of this patient well, what is supposed to be done. Then at the end of the day, what is going to be? Then we are going to have inaccurate patient plan. So the plan will not be good So we need to listen also to the patient. We need also to listen to the clients, relatives who have come to this patient, so that we have a good plan for this patient. If we have not communicated well, maybe to the relatives who have come to with the patient in to the hospital, maybe that person who is there as a next of kin have not communicated well. Like, for example, if it's a diabetic patient and have not communicated to well to the next of kin, maybe who is taking care of the patient in the ward, maybe this patient need to take this kind of food. Maybe I've not communicated well to this relative or next of kin. What are we going to have at the end of the day? This next of kin or the person who is there, he or she is going to bring maybe foods which are not necessary for this patient, and then at the end of the day, the plan will go awry. So we need to avoid this. Then delay to care. Maybe I missed something. Maybe I never listened well. Maybe I didn't read well what was written in the notes. And then if there was maybe a medication which is supposed to be given to a certain patient at a certain time, I never wrote. Like in nursing cadets, most of us we don't write. You find a nurse who has been in the shift since morning. She has not written anywhere. She has done all those tests. She has done so many nursing capacity. She has not written anything. So the next thing, it's we are going to delay to have a delay care to this patient, because we need also to have a plan to this patient. So if we miss these things, we are going to miss everything. And then we want to know now the impact of poor communication. What may bring what impact is going to be there if we don't communicate well. So impact of poor communication. Number one, we have poor communication can lead to various negative outcomes. Number one, discontinuity of care. So if we don't communicate well, that continuity of care will stop at that point. So we don't move, we will not move at all. And then we have it compromise the patient safety. So if we have made these medication errors, then we are going to compromise patient safety at the end of the day. So what are we doing? So please, my dear friends, let's be serious on this. Then next thing is patient dissatisfaction. So the patient will not be justified or will not be satisfied with our care. At the end of the day, this patient will seek another alternative elsewhere. So another one is inefficient use of valuable resources. So we are going to use so many resources which are not necessary for the care of these clients or patients. Effect service provider attitude. So it does effect on service with the provider who is taking care. So if we don't uh, uh, have a look on this, then at the end of the day, it's going to affect us. And then we want also to do handing over. We want something I want also to discuss, very, very important. This what we call ASPA, so which is very important. I wish I could have somewhere I can write for you so that you can read and know what it entails and know when do we use it and where are we supposed to use. Let me write for you so that you can understand this word SPA method. So we want to use this SPA method in handing over. So S, the first S, you have the first S. It stands for situation. So it's good you discussion of the current patient. So S stands for situation, and it means discussions of the current patient condition, including biographic data. You identify clients by name. Then what are you supposed to do? What is your major concern? What is happening at the present time? What are your concerns about? When did it start? For example, if I'm having a patient in the ward, maybe who is having PPH, and I'm making a call to another facility, maybe I want to transfer. So I need to use S such that the other person there who is receiving the call can listen and understand why am I doing a call? Why am I making a call? So first of all, I need to identify the patient by name. If we, for example, we use the word Elizabeth. So I'm calling that aside. I'll call hello, Daktari. I'm calling from Fremont Medical Center. I'm having a patient by the name Elizabeth Kemunto. So then from there, you have already identified the patient and where are you calling from and who are you, who are you. So you have identified yourself, you have identified the place, you have identified the person name. Then you go ahead, what is your major concern? And then maybe if I've said it's Elizabeth Kemundo, the Elizabeth Kemundo is having PPH, so my concern is having PPH which I've not been able to manage well. So what is happening right now? The patient I've tried to maybe to repair, I've tried everything, it has refused. Maybe the patient is still bleeding. So that's what is happening right now. You have done all the necessary, it has really failed now. Then what are your concern? What are you concerning about? So my concern is I want to transfer this patient for the best care or the continuity of care or for emergency cesarean if it was maybe a case for cesarean section. So what did you when did it start? So you need also to give a time length. When did it start? Did it start 2 hours ago, 3 hours ago, 4 hours ago, so that they can understand. So give the background information so that they can understand that is situation. And then we have the next letter, that's letter P, this one. So the background. So on the background, discussion of the background and the patient history. So in this part, you need to discuss the background and the patient history. So give any relevant medical or surgical history and the treatment to date. What is the admission diagnosis? What was the circumstance leading up to this situation? So just give us information on the background. So if maybe it is any story concerning medical or surgical, give. Then another thing, if any treatment you have given, just give. Then on admission, what was the diagnosis? Was it like now, if just an example I've given, if it was PPH, what was the diagnosis on admission? Was it in active phase of labor, latent phase of labor? Then maybe it was area labor. Just give the diagnosis on labor on admission. Sorry. Then what was the circumstances leading to this? Maybe you need also to give what might lead to this situation you are now reporting or you are calling or you are concerning. Maybe it was a precipitate labor. Maybe if it was a code prolapse, maybe just say I was doing active rupture of membrane, then after that the descent was high, and then I found there was code now presenting after I've ruptured the membrane. Just report what led to this. Just give that information. And then we have also A. We have letter A, which is the third letter. So assessment. Assessment includes any test and the result physical assessment. So at this point, I've said include any test and the results, and also physical assessment. What do you think the problem is? So what do you think the problem is? So if like now I was referring Elizabeth Kemundo. So the first thing I can say here, uh, from my test, from my assessment, the problem is like the uterus has maybe there was 40-degree tear which I cannot be able to repair. So that is my problem. I cannot be able to repair here. That's from my finding physical assessment. I've just found there is a tear, maybe a 40-degree tear. I don't have theater here. I cannot be able to repair. That is the physical assessment you've done. If maybe it's a lab test you are doing, maybe it was a PPH, and you have all checked the fault teeth, and you have found maybe the issue here is thrombin. So maybe you, in your place you don't transfuse blood. So will you put this patient here? You just want to transfer this patient. Just say, from my assessment, I've ruled all other three tests as a cause of uh, PPH. Maybe I found one which is thrombin. So the patient is having issue with the blood. So that's why I'm transferring the patient to you. Maybe you do blood transfusion, so the patient will be helped on your side. Just report whatever you've done. At that point, maybe you could have done clothing timing. So maybe at that time you find that the blood is not clotting. It takes long to clot, so it means that this patient really has this problem. You can also ask history. Then we have the next letter, that's R as the last letter, and that's PA. So the word at the letter R stands for recommendation. What is your recommendation for this patient? What is do you suggest to other team you are calling or you are referring or you are talking to? What do you want them to do? So sorry. So any orders that need to be completed or followed. So just to give what do you want them to do? What do you think they can do? So just give them what do you recommend? Maybe I recommend this patient to be transfused. Maybe I recommend this patient to offer better continuity of care on your side. Maybe I recommend this patient to be done CS, cesarean section, which I don't have on my side. Maybe I'm in a facility where we are not able to, or we don't have theater. So, what is your recommendation? Just important to you. Just report. So, I think you have understand the word SPA, what it means. So, you need to use that all the time when you are doing handover, when you are doing a transfer. So, very, very important as a tool for communication. So want also to move to the next step, that is effective communication in obstetric and the newborn emergency. So effective communication in obstetric or stroke newborn emergency. Call out or shout for help. So at this time, if you are having uh, emergency, for example, you are having PPH, don't keep quiet. Just shout, call out, help. I'm having PPH. So just shout and let your voice be heard so that whoever is coming, whoever is hearing that message, can people to realize there's an emergency somewhere. I needed to help. I have known what is really the call is. So just shout and mention why you are calling. Then think out loud. Verbalize your thoughts. Just think out loud. Just when these people come to you, don't be quiet. Just verbalize. Just talk whatever you have done, whatever you have found. If it's cord prolapse, just say, this matter I was doing rupture of membrane, and then maybe the descent was high. I've just found cord prolapse presenting. Sorry. Sorry. So just verbalize your thoughts. Then let them help you. Then at this time, let assign duties to them. So let not people come to you and they stare at you. And when you tell somebody, maybe I want to assist you, I want you to bring maybe gloves, all of them go to call those gloves. Assign them duties. Let's have somebody who is directing them. Let's not all of us running to one issue. We are going to lose this patient. So let's have somebody who is there to help us. So far price, think loud, and let's move. Then check backs, confirm details. That is very, very important. For example, I have told somebody to give oxytocin 10 international unit IM. So when I have told, maybe I was with my colleague, maybe it's Peter. I've told Peter, please give 10 oxytocin international, 10 international unit of oxytocin IM. So when Peter takes those instructions from me, he can go ahead and take oxytocin. Then before he gives, he needs to confirm. Evans, did you say I gave 10 international unit of oxytocin? Then when he's confirming to me, yeah, I will tell him, yes, I told you to give 10 international unit IM. That is what we call checkbacks. Just confirm from this person. Did you mean this? Did you mean me to shorten the code? Just confirm. Did you send me to bring oxytocin? Did you send me to bring gloves? Just confirm. So checkbacks very, very important. And then another thing, addressing the client directly by name. It's good to be called Evans rather than somebody calling you guy, eh, rather than somebody calling Mama. Just address somebody by the name. Evans, Elizabeth, Judith, how are you doing? Just address somebody by name. Very, very important. They like their names, they appreciate their name. It's professional. And then use SPA approach to describe the emergency. And I've already mentioned what is SPA. Use it in every time you have an emergency. Very, very important. Don't use your own approach. That's professional. It's being recognized everywhere. So use it to describe the emergency. So if you use it, whoever is listening to you will get it correctly. And we are going to avoid all those things we have already mentioned up there. Then closing loop, give timely feedback. Closing loop, it means, for example, we have given an example. If I told Peter to give oxytocin 10 international unit IM, Peter will come to me and confirm to me. Then confirming to me that's what you are saying checkbacks. So he will ask me, Evans, did you tell me to give 10 international unit of oxytocin IM? Then I'll tell him, yes, I told you to give oxytocin 10 international unit IM. So when Peter gives this drug IM, then he'll come to me and tell me, Evans, I've given oxytocin 10 international unit intramuscular. So he has closed that loop. That's what it means, closing loop. You give timely feedback. So when you finish this emergency and now you are sitting down to write these things, you can remember them 50. So you remember everything, the step how it was. You can remember, yes, I remember Peter asking me this. I remember Peter giving me this feedback. It has been done well. So let's use that thing I've mentioned, closing loop, when it comes to emergency. So up to that point, maybe if you follow all these things, actually at the end of the day, we are going to have a good continuity of care of our patients, of our clients. We are going to avoid errors on medications. We are going to avoid uh, we are going to avoid so many things when it comes to communication. So all to our patients. So very, very important, my dear friends. So at this point, I think you have listened well. You have gotten the message. Even if it's called a common subject, it's not common to all of us. But if we do this to remind and every one of us, then we are going to get them these things clearly, and we are going to have a good continuity of care. Then everything will run smooth, and we will say, "Wow, it was well done." So for now, I think I don't have any uh, point I can add or subtract from my small presentation. Maybe if you have something, just go down there, comment, and then share with me with friends, like, and then subscribe just to promote my channel. So next time, for now, I say thank you, my guys. See you next time. Goodbye. Good night.